Well, the big story that we're reporting, India is launching the world's largest COVID vaccination drive on a Saturday. That's what the government has said. That is the largest anywhere in the world, with the 3 lakh healthcare workers all set to be inoculated on the first day itself. Prime Minister Narendra Modi will launch the start of the COVID vaccination drive at around 10:30 tomorrow with the 3,006 vaccination sites across the country via video conferencing. Around 100 people will get the shot at each of these centers on day one. 1075 is the number of the call center in case you have any queries regarding the vaccination drive, and a lot of those questions we're going to try and answer in today's show as well. Now, the beneficiary list for the first day has already been uploaded on the CoWIN platform, and those people, and remember these are frontline workers, they've already received SMSs or information that they are there, that they will be getting the vaccine tomorrow. So it's a big day tomorrow when the vaccine drive will finally be launched. It's been called the biggest vaccination drive anywhere in the world. Remember now, one of the vaccines that will be used tomorrow in tomorrow's drive, there are 2 vaccines that have been approved in India. That's the Covishield vaccine, the one that's produced by Oxford, AstraZeneca being made in India by the Serum Institute of India. And the second vaccine is Bharat Biotech's Covaxin. Well, joining us now is Dr. Vikram Talailukar, Associate Specialist in Reproduction Medicine at UCLH. Thank you so much, Dr. Vikram, for joining us again. And, it's interesting to talk to you ahead of this big day tomorrow when the vaccine drive will begin, because you actually participated in the testing of the Oxford AstraZeneca vaccine. Share with us your experience as tomorrow the vaccine is going to be available in India.
Thanks, Kathy. Thank you for having me on the show. Well, it's a great day tomorrow. For many of us who participated in these trials, it's a day of pride. And of course, gratitude towards all the scientists who made this possible. It's fantastic to see that within 12 months of the pandemic starting, we've got an effective and safe vaccine. And tomorrow is going to be the day when India starts vaccinating. It's a big task, and there are many unknowns still out there. How long does the immunity last? What if more mutant variants come in? And what the long-term aspects of the vaccine are. But all the data so far we have had from the trials all across the world is that these vaccines are effective, they're very safe, and it's great to see that more and more people will get vaccinated over the next few months or years. So hoping that if all goes to plan, by the end of the year, if at least most of the vulnerable population and the healthcare staff are vaccinated, we'll have a good grip on this pandemic. I won't say it will end everything, but at least we'll have a good grip on getting towards normality in life.
Right, here in India, the first to get the vaccine are going to be, of course, the frontline workers and health workers, like we've seen in the UK as well. You've also had the elderly getting it first as well. If you could tell us a bit about the vaccine drive there. Initially, there were concerns that it was very slow, but it seems to have picked up in the last couple of days.
Yes, I mean, vaccinations are going very well. Initially, it started a bit slow because of both the number of people available to deliver vaccines as well as the production of the doses. Around about 2 million people have been vaccinated now. And the aim is, as I said, is to get about 2 million people vaccinated every week so that we can get to those 30 million by March. Yes, there has been a lot of improvement in terms of many centers being opened for delivering vaccines. The military, the paramedical staff, doctors, dentists across the country have been given the offer to give vaccines at their own area of practice. The production is also going on. You've got the Pfizer, the Moderna, both have now been approved. And of course, you have the AstraZeneca Oxford, which is the local homegrown vaccine here. So the production is again being ramped up to deliver as many doses as we can. It's a race. As you will know, the situation here is a bit stressful because you've got the mutant virus spreading fast and the lockdown has been in place. So hopefully we'll start seeing the effects of lockdown over the next couple of weeks. But as the vaccination keeps increasing, the hope is we defeat the virus before it can reach people. We reach people with the vaccine here. Fingers crossed.
Right, absolutely. We're also joined by Dr. Arvind Kumar, Chairman, Institute of Chest Surgery at Medanta Hospital. Thank you, Dr. Kumar, for joining us. So a big day tomorrow. Finally, the vaccination drive will begin in India, and it's said to be the largest anywhere in the world. Initially, on the day one, it'll be 3 lakh people who will get it, and that's frontline and healthcare workers. And then in the months to come, it's 30 crore people who've been identified by the government who will be getting the vaccine.
Yes, Gargi, tomorrow, that is 16th of January 2021, is going to be a historic day for India because one of the largest vaccination programs in the country will get launched tomorrow by our Honorable Prime Minister making a video call at 10:30. And to the best of my knowledge, every healthcare facility, a large number of healthcare facilities across the country have already received the dosages of vaccines. The programs have already been made. The people have been identified. We in our hospital at Medanta have received messages, who's getting it tomorrow, who's getting it day after. And the plan is that in the next 4 or 5 days, majority of the healthcare workers across the country will get covered by this vaccination. Now, I wish to take this occasion to inform all the viewers that a lot of rumors are being spread about various alleged side effects of this medicine. As a doctor, let me reassure people that both vaccines have been tested, tried, approved by the government. They are safe. Let me tell you, in my hospital, I'm not aware which of the two vaccines I'm going to receive, but either of the two, whichever is there, I'm going to go and get it at the appointed time. So therefore, the need of the hour is for all of us to stop the rumor mill and receive vaccine at as early as possible as per the scheduled outline. So healthcare workers, frontline workers get it first, and thereafter the next batch of about 30 crore people who are people above the age of 50 years or below the age of 50 years but with comorbidities are going to be covered in the next phase, which is likely to last next 2 to 3 months. It's one of the largest, most ambitious programs in the country, and I think it's the duty of everyone in the country to participate, to cooperate with the government and do their best to make it successful.
Absolutely. Absolutely. And as I was discussing with Dr. Vikram, we have two vaccines that are available here, Covaxin that's been produced by Bharat Biotech and Covishield, which is the Oxford AstraZeneca one, which is also available there in the UK. Now, Dr. Vikram, here in India, we're told you're not going to get a choice of the vaccine, at least initially in these months when it's being rolled out in this manner, and that nowhere in the world is that offered. What is the situation in the UK? You have 3 vaccines available there. Do people get to choose?
No, because the vaccines are delivered through NHS, which is the National Health Service here. As we know, all 3 vaccines are equally safe. They're effective. They're all very effective, more than 90%. So really, it's a matter of which one you get first, you go with it. It will depend on how many doses are produced by the company and how fast they are delivered to the health services. So here, there is no choice. Whichever dose the health service can offer you, they will give you priority. They will give the offer for you to come and have your vaccine. And you go there and you have the vaccine that you get. There's no choice as such between one or the other because all of them are equally safe and effective.
Right, that's what Dr. Arvind was also saying, that just go and get whatever vaccine that you're offered. And of course, you have a choice of refusing the vaccination altogether. That's also, it's not compulsory. Well, let's just listen into some of the questions we have. And Dr. Vikram, I'm going to try and get you in to some questions that you can answer. And Dr. Arvind, of course, to take those questions. Let's just listen into the first video question that we have.
Hello, doctor. This is Praveen from Navi Mumbai. There are some vaccines which are around 90% effective, whereas the one in India, they say it is around 70%. What does it mean?
Dr. Arvind?
I would request all the viewers to not fall in this trap of percentage of effectiveness. Now, what this number of percentage means is that if you give vaccine to, say, 100 people, if it's 95% effective, means that the 95% of those 100 will get protection, 5 will not. Now, regarding the 2 vaccines from India, these figures of 70, 80, 90, different figures have been floated. Let me reassure all the viewers that these vaccines are as effective as any vaccine anywhere in the world. The numbers being mentioned also depend on whether you're looking at the data after the first dose or the second dose. There also have been different dosages tried. So I, as a doctor, am to believe that both these vaccines are effective, they are safe, and they should be used. And I'm looking forward to getting my shot tomorrow. without finding out which of the vaccine is coming to me. It's not the time to go into these controversies. It's the launch of the biggest immunization program, vaccination program in the world. And I think the time is to, put all these rumors at rest and go for the best. And both these vaccines are the best available to us.
I suppose there's been so much talk about efficacy. As Dr. Vikram was also saying that there in the UK, the Moderna and Pfizer vaccines have talked about 90%. And we know that the Oxford-Zeneca one is around 70%. So a lot of the public wants to know, what does this mean regarding the vaccines? Let's just listen into the next question.
Hello, doctor. This is Shazia Sheikh Kasturi from Delhi. My question to you is, will we be able to buy vaccines of our choice in next few months?
Right. And Dr. Arvind, first to you, in the months to come, we expect there'll be a lot more vaccines perhaps available. And when it comes to people actually purchasing on their own, right now, they're going to be free. But perhaps later, people will be able to choose their vaccines?
Yeah, Gargi, as per the schedule announced by the Serum Institute, as well as the Government of India, the plan is that in the next 2 months or so, first, as I said, the healthcare worker, which number to total of about 2 crore, healthcare and frontline workers, and thereafter about 30 crore lot of people above 50 or below 50 with comorbid. So this is the first lot and the second lot which is to be vaccinated. Now all this is government controlled through government system in the various identified healthcare facilities. I am told that in about 2 months' time, Serum Institute is going to make, and maybe Covaxin also, is going to be made available in the market also, of course, at a higher price than the price at which government has purchased.
Sure.
But maybe it will be 2-3 months later, not in the next 2 months at least.
All right, let me just ask Dr.
Vikram. Through the government only.
Right, and Dr. Vikram, what is the scenario are you expecting in the next couple of months? Because it hasn't reached the general public in the UK either, has it?
Well, we're not expecting to roll it out through the private sector here. The NHS is aiming to vaccinate everybody in the population by autumn. So once the vulnerable population, the most needy ones are covered by March or April, we should be able to offer everybody a vaccine come August or September. So we will have the whole population vaccinated by then. Again, there is, I think, no need to choose between vaccines because whether it's the Oxford, whether it's the Moderna, Pfizer, and there might be more vaccine contenders coming in as the year progresses, as long as most vaccines are effective, more than 60-70% efficacy, and we've known that they are very safe, there are no major risks, I think whichever vaccine, it should be rolled out so that everybody gets a chance as soon as possible. Any vaccine is better than no vaccine because if you get COVID, if you have long COVID, it's equally as worse than not having a vaccine. So that's my message.
All right. Well, let's just look into some questions that have been sent to us on social media. And Deep Chaudhary wanted to know that with the number of new as well as active cases coming down in India, is it not that herd immunity has set in and shouldn't that be factored into the vaccination plan? Dr. Arvind, this is something that I've seen a lot of talk over the last couple of days, given that India's numbers have come down.
Yeah, Gargi, I would like to again use this opportunity to tell that let's not talk about herd immunity, and in the false notion of herd immunity, people throw the caution to the wind. These numbers are coming down because of the publicity by the government, extensive publicity by all the print, electronic and social media. People have been using masks. They have been practicing social distancing and hand hygiene. And if the numbers are coming down, I think it's credit to these 3 pillars because of which it's coming down. Whatever studies have been done of the seroprevalence, none of them have reported more than 35 or 40% antibody prevalence. And I don't think you get herd immunity at that level of seroprevalence. So let's not say that herd immunity is the one which is responsible for numbers coming down. And in that regard, throw the caution to the wind that, okay, herd immunity is there, we don't need vaccine, we can throw away the caution to the wind and let's go out and enjoy. That will be disastrous. Let us remember, it's a deadly virus, it's still lurking around the corner, and slightest of let up in precautions on our part will lead to next resurgence, and the next resurgence will be worse than any of the previous attacks. So let's remain cautious and cautious. Gargi.
Absolutely, especially what we're seeing in the UK, in Europe and the US as well. And, that is a cautionary tale to us. One more question, final question. Dr. Vikram, if you've been through coronavirus, we're told that you still go ahead and get the vaccine. And is that the same thing in the UK as well?
Yes, simply because we don't know how long the immunity will last. We know that if you have a natural infection with coronavirus, you're likely to be protected for somewhere between 4 to 6 months, approximately 5 months as the recent report suggests. However, if you have a vaccine, it's likely that your immunity will be long-term. You will have a better immune response because you get the initial vaccine and the booster. It might be a year or longer than that. We will know this as we study it further. But yes, you would have to still have a vaccine even if you've had COVID in the past.
All right. Well, thank you so much, Dr. Arvind and Dr. Vikram, for joining us and answering some of those questions that people have as we're counting down to the vaccination program, which is going to start tomorrow. Thanks so much.
Thank you.
Thank you. Well, news now from Germany, where another 1,244 COVID-related deaths have been reported in a 24-hour period, which is the highest daily figure since the start of the pandemic. Chancellor Angela Merkel wanted a mega lockdown, according to reports, shutting down the country almost completely for fear of the fast-spreading variant of the virus, which has been first detected in Britain. Well, to talk more about the situation in Germany, we're joined by DW reporter Emmanuel Chase. Thank you so much for joining us. Tell us, is the current lockdown likely to be reconducted?
Yes, the figures are still not good here in Germany, and Chancellor Angela Merkel warned that the country will go through 8 to 10 very tough weeks. Now, the daily death toll is around 1,000, and daily number of infections is way too high as well. Nationwide, the 7 days incidence rate is 3 times higher than what is already considered a critical threshold of 50 cases per 100,000 inhabitants. Additional measures were introduced this week in districts where the incidence rate was superior to 200 cases per 100,000 inhabitants, mainly movement restrictions within a 15 kilometers radius in worst affected districts. Only necessary travel is allowed, and there's also a curfew in some districts. That was already the case back in December, and some minister presidents of region are now admitting that they should have listened more carefully to what Angela Merkel and scientists had said when they warned that tougher measures were necessary to curb the infections. That's the case, for example, of Minister President of Thuringia, Bodo Ramelow, who said remarkably that he admitted being wrong in his choices to tackle the pandemic.
All right. Well, it's good that leaders admit that they've been wrong. And what would tougher measures really look like?
Well, this is something that has been debated here, which tougher measures to implement. For example, this would be working from home. This has only been recommended so far and not in any way made compulsory. So it's pretty much at the discretion of each company to implement. The schools are already closed until the end of the month, but that could very well be reconducted. And the 15 kilometers radius when it comes to travel could also be generalized. For example, businesses are already closed, so it's very likely that they would remain so.
And here in India, we're about to begin the vaccination program. Tell us about the vaccine program in Germany so far.
Well, the government drew critics for its rollout of the vaccine. It looked very promising at first, with more than 400 vaccination centers set up all over the country. Here in Berlin, there's even 2 former airports that are being used as vaccination centers, and another center has a vaccination capacity of up to 5,000 vaccinations a day. Yet nationwide, daily vaccinations do plateau at around 50,000, and that's far from the initial objectives. And Health Minister Jens Spahn had warned that January and the first weeks of vaccinations would be challenging before picking up, but this is taking too much time for some. And the government is trying to ramp up vaccination production, with a new production site for the BioNTech vaccine in Germany being set up. It should be operational by March, and the Moderna vaccine will start to be distributed next week. Now, among the population, 1/5 of Germans are skeptical about the vaccine and would refuse it, but over 60% of the population is willing to get vaccinated.